This comes to us from Anonymous. And it's obviously why it's being submitted as anonymous. And it's long. And I'm going to read it because I think it's important. These are the stories that need to be told, and they're told in when I watch TV on is, 30 seconds to a minute and a half to 2 minute little clips. And so this is why I'm reading this and talking in this kind of voice, these hushed tones, mellifluous, if I may say. I am an infection control nurse. I am extremely tired and angry. I'm just fucking worn out because of all of the assholes in this country. I have never expected everyone to share all of my opinions. I'm fine with that. There was a time when it was possible to have an intelligent conversation with someone who doesn't share your outlook on life, trade ideas with him or her, and God forbid, maybe both opinions will morph into some sort of common ground. I know it's crazy, but it used to be possible. It may still be, but I find myself less and less willing to even try because you never know when someone is going to reveal themselves to be an asshole of the my facts are facts, your facts are opinions. My opinions are facts, your opinions are incorrect. That kind of variety. Or simply put, I'm right, you're a doo-doo head. Facts are facts, and opinions are opinions. Nothing more, nothing less. If you or someone on the news puts a spin on it, you are venturing into opinion. Opinions can be wrong. Not just the opinions on the news source you dislike, but all news sources that focus on opinion over facts can be fucking wrong. You need to sift through the bullshit to get to the facts. I swear to God, Lewis, that if Jack Webb was still alive and doing Dragnet today, the series finale would have him put a gun to his head and pull the trigger because he'd be so fucking tired of repeating just the facts, ma'am, only to have to sit there and listen to some Karen spouting off opinions she believes are facts because of what Mother Tucker Carlson told her on Fox News. Before this next paragraph, I should say some of what Lewis is about to read will be graphic in nature. Listener discretion is advised. This is the case with many colleagues who also work in infection control. It wasn't my first area of nursing. My first decade plus of nursing was in intensive care units. I saw a lot of depressing things during that time. I saw someone who had tried to commit suicide by jumping off a bridge. When I got to work that day, he hadn't died yet, but his entire head was mangled, broken, and bloodied. I had another patient who was in her 90s and her heart stopped. She and her family insisted that everything be done. So we started CPR. I started chest compressions, knowing what would happen, and it did. She was so frail that during the first compression, all of her ribs broke in succession. It felt like someone was inside her pulling a zipper as each rib disconnected from the sternum. I had another patient who had his entire chest open with his intestines swollen and protruding, looking like they were just sitting outside of his body on his chest. Yet he felt well enough that whenever a female colleague came into the room, he would kick the sheets off to show off his dick to them, even though his dick had a damn catheter in it. I had another patient who crashed and who had somehow gotten her esophagus and intestines to somehow graft together internally. And so that when we started CPR, with every compression, shit was coming out of her mouth. That was the most disgusting thing I've ever seen, is I can still not look at my kid's Play-Doh toy where you pull the lever down and the dough is turned into some long tube or something, because that is what the excrement looked like coming out of her. I've seen horrible intestinal bleeds, experienced terrible smells that would burn your nose hairs, and death. Lots of death. Several patients with whom I had developed a relationship over days, weeks, months, or in some case, years. watching helplessly at the monitor at the nurse's station as a patient's heart rate slows and eventually flatlines, while family members in the room scream and moan over their loss, questioning whether or not they had made the right decision by following the patient's wishes and enacting the DNR, do not resuscitate, or living will. Don't get me wrong. There are a lot of good and rewarding things about working in healthcare and as a nurse, but there are a lot of depressing things as well. That being said, nothing in my nursing career has been as depressing and soul-crushing as the pandemic. Since I am an infection control nurse, I was worried about COVID-19 in December of 2019, when the stories started coming out about what was going on in China. I was reading about it in medical journals, not Fox News, not CNN, not MSNBC, not even NPR. Medical journals, peer-reviewed journals, which means, as another ranter recently mentioned, that other medical professionals look at the study being discussed and say, I agree this is a good study that I have replicated and had the same results. Or they say something along the lines of, hey, dumbass, your study sucks because you forgot to do this or that. So the crap studies are discarded. That's how science moves forward. It does not move forward by some supposed scientist bypassing the peer review process and posting their flawed research on social media or on some slickly produced YouTube video. That's not fucking science. Throughout this pandemic, I have many friends, family, and colleagues come to me for information. I have tried to provide the facts, numbers, data, etc. I have mentioned when data has been verified or whether they are estimates. When I don't know the facts, I make sure I mention that what I'm going to say might be wrong or might be just my opinion, but here's what I know based on my experience or where the research is at the moment. It can be easy to forget that I have information that the general public doesn't have. So I was often taken aback by the thanks I got from many people. Sadly, what wasn't surprising was those who attacked me and claimed I was spreading lies. Some were people who I thought I knew, who turned to be thin-skinned supporters of Agent Orange and his parade of never-ending bullshit. I knew these assholes were out there. I was quickly labeled some sort of socialist or communist for not going along with the conservative media's opinions. Healthcare, like teaching, and probably stand-up comedy, is one of those fields where people automatically think they know everything you do and that their opinions are as valid as yours. I have never told a plumber, an electrician, a computer programmer, a teacher, or a stand-up comedian how to do their job because I do not work in any of those fields. Yet some people insist they know as much as me about healthcare and complain that I'm wrong and misinformed. In some cases, I may be wrong, but that doesn't mean the bullshit coming from your mouth is right. While my hospital hasn't been hit as hard as other hospitals around the country and the world, there have still been thousands of patients diagnosed with COVID and several hundreds who've been hospitalized. Some recovered and returned to their normal lives. Some died. Some have experienced long COVID. I know one person who was still using a walker and oxygen 7 months after being released from the hospital, despite having been healthy and athletic before COVID-19. So when the vaccine finally reached us just prior to the end of 2020, the mood in the hospital was magically improved. You could see it in the mask-covered faces of both the staff and the patients. You could feel it. Hope was back. Unfortunately, that feeling is gone now, as we are down to the anti-vaxxers and the Agent Orange supporters who refuse to believe that Corporal Heel Spurs even got the vaccine. I saw someone on the news say he didn't want the vaccine because he was afraid it would turn him into a Democrat. It's a fucking vaccine, not mind control, you motherfucking moron. As I type this, the source I get my data on COVID-19 from lists 3,381,515 reported deaths from this virus worldwide. In the United States, we are at 33,692,827 reported cases and 599,829 reported deaths. The number of deaths in the U.S. trails only two other events in U.S. history. The Civil War, with an estimated 620,000 U.S. deaths, and the 1919 flu pandemic, with an estimated 675,000 U.S. deaths. It is likely that the COVID-19 numbers are even higher, but I stick with the reported numbers which have been verified. But if one more person tells me that the deaths are overcounted because if they have anything else and die, they count it as a COVID-19 death, or tell me that this isn't really a pandemic, I'm going to lose it and maybe end up getting arrested for assault. I report our hospital's cases and deaths to my state after we review them. The state then reviews the cases. They are reviewed multiple times, and there have been cases that I thought should be considered a COVID-19 death that were not counted. It's a long process. And just because you heard about some guy who died after he choked on a piece of chicken, but was counted as a COVID-19 death because he had just gotten over it, doesn't mean that actually happened. I've ranted long enough, and I appreciate you reading this. I will end with this. I am an infection control nurse. I don't need to be thanked. I don't even want to be thanked. I just want you to do the right thing and be the tortoise and not the hare. Don't stop and screw around and then wonder why you didn't make it to the finish line. Going slower is better if it means crossing the finish line. Cases are going down. Things look better, but things can change quickly. Maybe not like the horror show that is currently going on in India, but things can still get worse. Wash your hands, wear your masks, and get your damn vaccines if you haven't yet. Do that. And that will be thanks enough. I want to thank you for sending that in. I know that was a rugged one, but I think it mattered. Every so often as I was reading the log, I thought of many folks I know and actors and folks I know who do voice work, and so I thought, wow, they'd be really great at this. But this is why I do it. You know, I keep repeating it's for moments like this. For moments like this and moments like peanut butter that really irritates somebody because it's crunchy and it should have been smooth. That's why I do it. I just thought it was really important for that story to be told. I don't think it is told in given the time frame that is necessary to complete the story. I'm thrilled you got the story so splendidly written and to us, and we're able to share it. I look forward to your other rants. Thank you. And I know it's meaningless, but thank you for what you have done and been through. And it has always enraged me that when people don't do what they should do in terms of this, and then consider you, those of you who have been working in hospitals, to be heroes, and then don't do the things that would allow you to be easier for you to be heroes.